Good morning.
In the brain.
You guys ready?
In the brain.
Good morning. Thank you all for being here this morning. I'm pleased to be here this morning with delegates Marshall, Nixon, and Hamilton, and many members from the NFIB and the Chamber of Commerce. Good Americans all. Clearly, the repercussions of the current economic recession are reverberating throughout living rooms and boardrooms all across the Commonwealth, as well as committee meeting rooms here in the General Assembly building and on the House and Senate floors. Virginia businesses and families are grappling with tough choices on how to bring their finances into balance. People are worried about keeping jobs, they're worried about paying their bills. House Republicans understand their difficult times, and we are willing to stand up and try and help them the best way we can. Virginians aren't seeking just our sympathy or empathy. What they're looking for and what we're trying to provide are real solutions to help them overcome these tough financial hurdles and tough financial difficulties they find themselves in. They want representatives in Richmond who are going to work together to produce practical, sensible solutions that deliver real results to address their most pressing issues. And that's why we're here today, to highlight and to discuss House Republican Majority Caucus's package of practical solutions to one of Virginia's most fundamental economic concerns, access to affordable health care. Because too many Virginians are struggling to cover the rising cost of health care for their families and employees, House Republicans have crafted common sense solutions to meet this serious challenge. Over the past several sessions, House Republicans have shown strong and aggressive leadership in developing, advancing, and in enacting reasonable reforms in the area of health care services. For example, we have made the purchase of long-term care insurance more accessible and more affordable. We have strengthened Virginia's critical safety net options. We have made a high priority to protect and help our most vulnerable citizens with mental health concerns, and we've improved the availability and the care offered to our military service members and veterans. In fact, offering innovative and practical solutions to Virginia's challenges is a hallmark House Republican leadership in the General Assembly. And now, with the Commonwealth confronting the most difficult economic environment in the last 2 decades, it's essential to build and to expand upon our previous accomplishments, providing real results that will further improve the quality of life for all Virginians. This session, our health care package, seeks to address the worries people have about their access to and about the quality and price of health care services. And that is why the innovative approaches that we're championing today will give Virginia's many small businesses the ability to offer affordable health care coverage for all of their employees. Small businesses and startups throughout our Commonwealth have long provided the foundation of prosperity and will undoubtedly be the lifeblood of future economic recovery. Delegate Danny Marshall will outline his bill that will help small businesses remain competitive by allowing them to offer market-based health insurance decisions so they can attract and retain the best and the brightest workers. We also have legislation by Delegate Phil Hamilton that will increase competition for health care, which will result in higher quality services and greater access and affordability. And House Republicans, again, are helping to make it possible for Virginia to take major steps forward to further incorporate 21st century technology and into our Commonwealth's medical care so that errors are reduced and the lives are saved. Delegate Sam Nixon will discuss his bill to better ensure our medical system operates as efficiently and as effectively as possible. Now I'd like to turn the program over to Delegate Danny Marshall to explain his bill on small business health insurance. Danny?
Good morning. House Bill 2024. Virginia has legislated health insurance policies that are unaffordable. Health insurance coverage is financially out of reach for many lower-income workers. In Virginia, we have over 1 million citizens that do not have health insurance, and one of the main reasons is cost. House Bill 2024 will provide an opportunity to increase the number of individuals with health insurance and decrease the number of uninsured. By health coverage, previously uninsured individuals will be able to access care. Providers such as physicians and hospitals who have provided uncompensated care would be able to receive payment for their care rendered. House Bill 2024 includes 3 components designed to help individuals who are currently uninsured gain access to health insurance. Number one is insurance products that would include all of the mandates, but the benefits would be capped at a specific dollar amount. This would allow consumers to have access to preventive services that are so crucial to controlling chronic conditions. Number two, another position of this bill would allow employees and insurers to design benefit plans that fit their needs and budget. Number three is the final piece, would use CPON process to allow hospitals and charitable foundations to help fund insurance coverage for uninsured, low-income workers, and insurance premiums costs could then be split between the charitable fund and the employers of the employees. I would now like to turn it over to Julia Hammond, who is the State Director of the National Federation of Independent Business.
The National Federation of Independent Business, NFIB, represents Virginia's small and independent businesses throughout the Commonwealth. For 20 straight years, the #1 concern of Virginia's small businesses is the cost and the availability of health insurance. We strongly support this bill as it will allow Virginia's small businesses, especially those who have not been able to provide health insurance, access to affordable, good quality coverage for themselves and their employees. As you well know, most of Virginia's small employers receive their benefits through their companies just like their employees do. So we're talking about the mom and pop shops who, when they lose their benefits, they too lose them for their families. This is a wonderful piece of legislation. Some information you might not be aware of for these small business markets. Between 2001 and 2007, the number of small employers who offered health insurance dropped by 90%, increasing the rolls of the uninsured. In Virginia, less than 48% of small businesses, that's the 2 to 50 employee market, can afford to offer health insurance to their employees. This is a huge concern to our membership. Small businesses want to give benefits. They don't want to give basic benefits. They want to give the absolute best possible benefits. They'll be able to attract and retain quality employees. Unfortunately, cost is what gets in the way. And so with a bill like this, we'll be able to do that and bring in quality employees, be able to offer wonderful benefits, and help grow Virginia's small businesses throughout Virginia. Thank you so much.
I'm here to talk about House Bill 1598, which was related to the Certificate of Public Need. That's a very complex law in Virginia, and so I'll try to break it down as simply as I can. Healthcare providers that want to either build new healthcare facilities or offer new services have to get permission from the state and demonstrate that there's a need for this facility or this service to be offered. And House Bill 1598 seeks to streamline that process. Our current law has 21 criteria that the Commissioner of Health is supposed to examine in looking at these applications. In talking with the Commissioner and the administration, they readily acknowledge that there's only a few of those criteria that they actually focus on. So what we did this year is we introduced legislation that reduces the number of criteria to be considered from 21 down to 8. And those 8 criteria focus on increased access to care, affordability, institutional competition. And those are critical to providing services to the citizens that we seek to serve. In addition to that, there's an expedited process for the conversion to psychiatric beds. The growing demand for community-based services within our mental health system requires the ability of the industry to move more quickly to create those facilities for psychiatric beds across the Commonwealth. And as Delegate Marshall mentioned earlier, there is also the provision where hospital systems can account their charity care and their services to the indigent in meeting the financial obligations related to the Certificate of Need purpose. With that, I'll turn it over to Delegate Nixon.